Hey everybody, I'm going to show the posterior ankle impingement test. There were some questions about this, so here we go. When you suspect pain back here in the back of the ankle that just doesn't go away no matter what you've been doing, there may be a situation called an os trigonum. An os trigonum is basically the posterior aspect of the talus, so this is the talus calcaneus. The talus with some people is bigger in the back and normally doesn't give you a problem. You don't even notice it, except if you're doing things like a ballet dancer does or anybody who does a lot of plantar flexion like this. You can imagine in plantar flexion the talus is supposed to glide forward and down, and the back of it can get caught over time. If they dance in point shoes, they're always in this position, a lot of weight bearing down. They're doing different kinds of functional movements for choreography and dance that really challenge this area. And of course the gastrocnemius, the Achilles, everything's working so hard to constantly point that foot. Over time this will start to get beat up, and eventually with a lot of people it fractures, and so you have a floating piece of talus, a floating bone back here. Take note, after you do an x-ray you'll see some people have a large os trigonum. They don't have pain from that. And other people have a small os trigonum. They do have pain from that. So size does not correlate with symptoms. So here we go. The test is this. Have your patient or client lie in prone and just have them lie down passively like this. There's three categories of this test. Those who get pain right there from this, just lying there, they're acute, the inflammation is very high, or both. And so that's an indication for you have to do things to calm that down and maybe try different rehabilitation, different functional exercises. I'm not going to get into that part to see if it gets better, but then you have that category of client, they don't get better. They need an x-ray. So you need to refer them to a physician to get an x-ray to see if there's the presence of an os trigonum or extra piece of bone back here, in which case they may need surgery. If they are in a functional activity like dancers, they're always in this plantar flexion, it'll never go away. They need that removed. It's a simple surgery and they get back real quick. The second test is if they pass this test and they have no pain, you got to take it up a notch and give some overpressure. So you mobilize, here's the calcaneus, you're going to literally push it cephalad towards the head, which is what? That is a more plantar flex position of the calcaneus relative to the rest of the foot. So when you do this, that forces the talus into this small space. The talus is supposed to get out of the way. It may not, or there may be a big piece of bone, fractured bone. Again, a certain category of people will have pain. That's a positive posterior ankle impingement test. If they still don't have pain, you have to take it up a notch to another level, especially with dancers, because they have already so much plantar flexion, they're used to that. You need to get one hand here on the calcaneus, you need to get the other hand under on the top of the foot, and you do both. You do a glide in this direction, a cephalad glide that way, and you pull the foot into more plantar flexion, and you may have to lean even down into the table, and that shouldn't hurt anybody. You may feel stress, but it should not hurt, especially with dancers. But if they hurt in the back right there, specifically right in here, they probably have an os trigonum, needs to be confirmed by x-ray, and you can even feel they get a crunchiness, and that's what a question we had today, yesterday on the forum. The person has a crunchy feeling when they plantar flex their foot. You can actually feel the crunchiness when you move and take it and move it passively or have them move actively. You may feel that crunchiness. So there you go, posterior ankle impingement test for posterior problems in general and for the os trigonum syndrome in particular.